Good morning, everyone. My name is Peter Gudaitis, and I'm the Executive Director of New York Disaster Interfaith Services, which is one of the three partners offering today's webinar. We're also joined by Dr. Henry Goldschmidt from the Interfaith Center of New York, and I don't see anyone else on from I'm sure we'll be also joined by staff from the Mayor's Office of Thrive NYC, which is New York City's mental health resilience and intervention initiative. So we thank them so much for joining us in this effort. This cover page that you're looking at today has the link, if you haven't seen it yet, to this Newell toolkit. It is in two pieces. There is a section that is an evergreen resource, a permanent resource on mental health resources for faith community leaders. And then there is a module on, specifically on the pandemic, the COVID-19 pandemic. Slide, please. Next one, please. Thank you. So I just want to introduce our lineup for today. I'm going to pass off to Father Stephen Harding in a moment, who's going to walk us through the toolkit, which was written by him and the Reverend Dr. Two very experienced disaster spiritual care experts nationally, and both who have a long history with New York City as clergy here. And then our awesome panel, three women who will be sharing their experience as faith leaders in their different traditions and reacting to the content of the toolkit and their own wisdom and experience from their traditions. So, and then we'll have a dialogue together. But we're super grateful for your time this morning. And I want to briefly name one thing before we start, which is we are facing an unprecedented pandemic with COVID-19 that has disparately impacted communities of color in New York City in particular. And it is also having a similar impact in other states. But that is happening at the same time that American history with race and racism has once again just kind of shook the nation's conscience in a way that's actually made a difference beyond a few news cycles, which is certainly good to see, but it's also something that we have to talk about candidly as faith leaders in the context of COVID-19 and how that is affecting mental health nationally, not just for the American people as a whole, but particularly for people of color. And that is unique, of course, for the African diaspora and America's history of slavery and oppression of the Black community in our country for almost 300 years. So how do we have that conversation in a way that overlaps? Because I don't think there's any way of separating the two. So thank you for joining us, and I now give you Father Harding.
Good morning. Thank you all so much for joining us this morning. I am actually speaking to you from Martha's Vineyard off the coast of Massachusetts, but my heart is still with New York City, which is where I grew up and worked for over 30 years. So we will begin with this video from Susan Herman.
My name is Susan Herman, and I'm the director of the Mayor's Office of Thrive NYC. Thank you for joining this webinar on faith and mental health. Thrive promotes mental health for all New Yorkers, and we do this by closing gaps in care so that people and neighborhoods who have gone underserved for too long can access support where, when, and how they need it. But we know that when you talk about promoting mental health in our city, you need to talk about faith communities. We know that faith leaders listen, counsel, and help heal psychic wounds. And we know that your congregations turn to you for guidance and support. For the last few months, when so much uncertainty, sadness, and grief have been layered onto New Yorkers, your leadership has sustained so many. And we thank you for being there for your congregations. We're also grateful to our partners at the Interfaith Center of New York and New York Disaster Interfaith Services. Together, we offer you a toolkit with suggestions and resources to use now during the pandemic and for years to come. We hope that today's conversation will be lively and informative. Thank you for all you do to promote mental health and spiritual well-being in our city. And thank you for taking the time to be with us today. My name is
Sorry
Susan.
about that. So, thank you again for being part of this. The toolkit is intended and it's written to help you. And it's written to help make mental health care available and more accessible to everyone in New York City. It's not just something nice that sits on the shelf. We wrote it to actually be useful and to be usable. And I want to tell you a little bit about it. I want to tell you what's in it. And I also, as Peter mentioned, want to start out by looking at the context we're in at the moment in our country and in the city. I want to tell you what this toolkit does. I want to show you how it can work for you. I want to tell you the four most important things in it, provide referral resources for you for mental health services, and then to answer your questions as time permits. And you can write a question at any time, excuse me, write a question at any time by using the chat feature on the screen. So with that, that's the next 18 minutes. So I want to tell you a story. It's a September 11th story. And I was serving as a volunteer chaplain with the American Red Cross in one of the family assistance centers somewhere between 2 and 3 weeks after September 11th. And I happened to be standing near the door, and this woman came in. And she looked a little disheveled, and she looked a little not quite there. So I went over and I said, "Hi, my name is Stephen Harding. I'm one of the chaplains. How can I help you?" And she said, "I'm here because of my son. My 8-year-old son came into my bedroom and told me that I had to get out of bed and that I had to get help. So when he came in, I got out of my bed and now I'm here." I said, "Thank you. May I introduce you to a colleague of mine?" And she said yes. And I walked her over to one of the mental health counselors who was working that night. And I introduced them and I stayed with her until the other individual said, could you come with me and we'll take the next step." So a couple of things about that story is that every disaster has its own life cycle, right? You have the event. In this case, it was September 11th. We had the aftermath. We had short-term recovery, weeks to months, long-term recovery, months to years, learned a few lessons from it, got ready for the next event, anticipation, preparation, teaching, so that when the next event happened, we'd be ready. right? So that's the cycle for a single event or a single disaster, September 11th, Sandy, floods, hurricanes. And this pulse-like thing is the emotional trajectory of a disaster. You go along, the disaster hits, everyone emotionally dips a little, the heroic phase, everyone rallies, does well, and then after a while, you get disillusioned because it's not over and things still don't work. And you know, it's just really hard and all the hopes that you had aren't really happening. But then from there, from that end of the disillusionment, you start working through it, coming to terms with what happens. And eventually you end up with a stronger emotional state than you had before whatever the event was. So my woman was sort of right after the event over here and probably down in this little dip right there. And the thing about mental health, right? It's part of being human. It's part of being whole and being balanced between being mentally healthy, spiritual, emotionally, physical, cognitive, right? You want the balance. But all the challenges that come with achieving mental health before COVID-19 are all there. And now they're all magnified, right? It's harder to get care because you can't get out. You can't go see a therapist. Zoom is fine if you have it, FaceTime, but the direct connection and the access to care isn't there as much. And there are multiple losses going on at the same time, not just deaths of people, but the loss and grief, but the loss of routines, of spaces, of jobs, of physical closeness, touch. There's a lot of loss and a lot of grieving going on. And over time, one can get into the disillusionment and it's just exhausting to keep going. So all that happens after an event. But now, as Peter said, we have two going on. We have COVID, right? Maybe we're down here somewhere, maybe we're there emotionally with COVID in the disillusionment phase, but then George Floyd, the whole world saw his death. And now this country and the world are looking at racism. So I've overlaid these two slides because one could have started here and now one could be down here somewhere because of the overlap and the asynchronous, the overlapping of the two. It's like you could be here for COVID, disillusionment, or maybe you're working your way back up for COVID, but you could be right down here with the anti-racism movement that's going on. So as faith leaders, as community leaders who are thinking about the mental health of the members of one's community, it's like the foundation is very unsure because you could be in two different places at the same time for two different events. And it's really helpful to know where the individual is, where you are, where we all are separately as we experience COVID and as we experience the anti-racism movement, as they both develop simultaneously at different speeds. So this is, so in that context, we offer you this mental health toolkit. And the first most important thing in it is what to look for, right? And the thing to look for is time. How much time has gone by since the individual was affected by either COVID or by the anti-racism movement that's happening now, right? And then once you know where they are in relation, my woman at the Trade Center was 2 to 3 weeks away from the event. But then you look also, one should look also for the acuity of symptoms, right? My person, 2 to 3 weeks after the September 11th attacks, was hiding in her bed under the covers and not able to get out until her 8-year-old son said, you have to get out and you have to get help. So what we're going to do is just look at some of the signs and symptoms of stress for a little bit. But the thing to remember is how much time has gone by since the originating event and what is the level of symptoms that the individual has. Now, it's normal to feel stress as a common response or reaction to physical distancing, isolation, and quarantine, especially if it's not possible to go to work. One has children, they aren't in school, and how do you manage this? That would be any stress from that situation would be totally normal. But my woman wasn't totally normal. This was not a normal stress reaction. Her symptoms, and this is acute stress, had gone on for a significant length of time and wasn't paralleled for her by any external stressors, right? September 11th happened, and here she was 2 to 3 weeks later, still affected by it. The symptoms of stress are magnified or experienced most of the day. She was in bed all day. And the symptoms of stress begin to affect a person's ability to care for themselves or be in relationship with others. And this woman fits all three of these. And on page 30 in the toolkit, there's a table that shows reactions of stress in the cognitive, the thinking, the physical, the emotional, the mental, and the spiritual areas. So it's helpful to see what's there. And stress can go on, right? So if these continue, one can have signs of traumatic stress, of trauma, right? And usually, if symptoms go on for between 3 and 6 months, then the mental health experts start thinking about traumatic stress. And after that, in the toolkit, I'm just showing you some of what's in there, are risk factors for traumatization. And the first one is if you are a member of an ethnic or racial minority group, right? You are just at risk, and it's not fair just by being who you are. So in all these signs of stress, acute stress, risk of traumatic stress, and traumatization, it's really important to know when you reach your limit, when you reach the limit of what you know and how you can help. And it's important to know that because as faith leaders, all of us are at risk for secondary or vicarious trauma. That is, that through constant exposure to multiple deaths, multiple grief, witnessing serious trauma, injury, death, just by seeing it over and over and over and being exposed to it, we too can be traumatized and develop all the signs and symptoms of trauma without understanding. It's nothing happened to me directly, but we see it, you hear it. And on page 36, there's more information about secondary trauma and how to reduce one's exposure to it. So the reason I talk about secondary trauma is because of these two people. Dr. Laura Breen on the left was an emergency room physician in New York City. EMT John Mandello was an emergency medical technician with the fire department of the city of New York. Both of them were caring for COVID-19 people. Both of them took their lives and committed suicide. And we included them here to honor their lives and to honor their service, but also to say that this is very real. And please take care of yourselves. If you find yourselves becoming overcome, swept up, if there's something going on, to stop, take a step back and reassess what you need for you, rather than just trying to cope and serve the world without taking care of yourself first. Suicidality in these double pandemics, it's there and it's real. Also in the Mental Health Toolkit are terms and definitions. We talk a little bit about moral injury, about grief, complicated grief and funerals. We talk about self-care. And then there's a section on how to support mental health year-round. And there's a monthly mental health action calendar. All of that's in there. And this is the fourth most important thing, or third. It's when to refer. And if it looks like the slide for acute stress, it's because it's the same exact slide. When to refer someone for mental health is when the symptoms of stress continue on for a significant length of time, when they're magnified or experienced most of the day, and when they begin to affect a person's ability to care for themselves or be in relationship with others. How to is you don't just dump the person. You don't say, you need to go see somebody else. Let me know how you get on. Don't do that. Talk with the person. Let them know of your concern for them and for their well-being, and suggest that you could refer them or you could introduce them to someone who could probably help them more than you can. Let them know that you care and explain why you're concerned. And if you have the option, present different possibilities of referral. The best referral is to someone you know and that you trust. If that isn't there, then there are other places to go, like NYC Well, which we'll get to in a minute. But talk about the fees, location, accessibility, and assure the person that you are not abandoning them, that you will stay with them, and that you might even go with them on to their first visit. Places to refer, as I said, are NYC Well. You can call them, you can text them, you can chat with them. And the thing about NYC Well is that these, if you ask for the crisis support team, they will dispatch a team of mental health professionals, not the police. It's not like calling 911, but call and ask for the crisis support team or the mobile crisis team. And they will come to the individual. So when you go online to NYC Well, you will find that under mental health, if you type that in their search bar, you will find any number of filters. And this is just a sample, right? For dual diagnosis, for Are you a first responder? Is the individual part of the HIV or AIDS community? Are they homebound? Are they homeless? Are they of the immigrant population? Are they infants? Those are just some of the categories so that they know how to direct you to get the help you or the person you're referring needs. There's a section about payment information, age, and then the borough. And we included in the toolkit the national helplines for national suicide prevention, domestic violence, the National Alliance on Mental Illness, substance abuse, and the Disaster Distress Helpline. So all of these are in this toolkit. We wrote it so that it would be helpful to people who are faith leaders, who are doing what you do. So with that, I will turn things over to the Reverend DeShannon Barnes Bowen. And thank you so much for listening.
Thank you, Father Harding, and thank you everyone for being here. Can you all hear me okay? A thumbs up? Okay, great, great, great. Wonderful to see you. And I'm serving the role as moderator, but I want to introduce myself first because we really want to hear what our panelists have to say. So as Father Harding said, my name is Reverend DeShannon Barnes Bowens. I'm an interfaith minister and the co-director of One Spirit Interfaith Seminary that's located in Manhattan. Spiritually, not only am I an interfaith minister, but I am also a practitioner of the Ifa tradition, so that is where my grounding is. I'm an Ila-Risha and an Ia-Nifa in that path, and that has been my heart and home spiritually for almost 20 years. That was part of the reason why I was asked to moderate this panel, because I'm also a psychotherapist who specializes in vicarious trauma and healing from sexual trauma. So given this time, in this season of two pandemics that we were living in, one of the pandemics actually is not new. We all know that that has been going on when we speak of racial violence and injustice, but we are here to discuss how we can be better, healthier, and access the resources that are available to us in terms of maintaining and sustaining mental health. And with that, I would like to have our panelists introduce themselves before we actually get into the questions. Once they introduce themselves, then I'll ask them a couple of questions. They'll share their thoughts with all of us, as well as their feedback on the toolkit. And then after we get done with that, we're going to open it up to all of you who are attending. So if you have questions or comments that you would like to pose to any of us, that we can accept that and process that as well. So first, I am looking at Dr. Marie, and I want to ask if you can unmute yourself, Dr. Marie, and introduce yourself to everyone here and let us know who you are and your background.
Well, good morning. It's good to be with you despite the challenges of the times. My name is Marie Lily Surratt, and I'm not a medical doctor, but I do have a PhD in urban education and Africana studies. I am Haitian, born and raised in Haiti, been in the United States for a little bit over, almost 40 years, not a little bit over 30 years. I teach at Brooklyn College with Africana Studies and Modern Languages and Literatures Department, and I'm the co-founder of Haitian Women for Haitian Refugees, a group that has been in existence since 1992. After the co-founder, Nina Raul, and I returned from Guantanamo, serving as a language specialist, assisting the Haitian refugees who were fleeing the violence and socio-political upheavals that followed the toppling of Jean-Bertrand Aristide, one of the most recent presidents of Haiti, or the first democratically elected president of Haiti in modern times. And I am a practicing vaudouisan. I was raised and grew up in Vodou, in the midst of a Vodou community. My grandparents and parents practice. I practice, and although I don't have a temple of my own, my home is my temple, but I congregate with other practitioners in the community for various rituals of Vodou.
Thank you, Marie. I'm so glad that you're here. And now I would ask for Ilarisha Oloriwa-Ama to unmute herself. And could you please introduce yourself to everyone gathered here and tell us a little bit about you and your background?
Sheila Fiani, good morning. Or is it afternoon already? I'm not even sure. COVID has our time all crazy, but hello, everybody. I'm so happy to be here. Thank you, Henry, for inviting me. It is truly my honor to be here. I am Ilarisha Ama Oloriwa, although it says Oloriwa Ama, but you know, we're all tech experts, but not quite. I am a priestess of Obatala, initiated 37 years ago, right here in the Bronx, New York. I also have initiations in Nigeria. I am a mother of 3 initiated priests as well, and godmother to several. I'm on the board and a founding member of several Orisha organizations here in the city. The Omo Batala Egbe I'm a founding member there. I'm also a member of Oloshis United. And I am the founder and director of Egbe Iwa Odokomrin, Egbe Iwa Odobirin Rites of Passage for the youth in our community. I am an activist, I am a leader, I am a proponent for all things resolving around and about justice for all of our people. So again, it's my pleasure and honor to be here with you all today.
Thank you, Iya Ama. And so I want to start with actually asking, since I'm going to start with you, if that's okay, Iya Ama, and asking the first question, and then I'll bounce back to Marie. And the first question is, in terms of this toolkit, what, if anything, resonated with you with the toolkit in terms of how it could be used or accessed or helpful to the communities that you work with?
Well, the first thing that resonated to me was the fact that it even exists, that we actually have this as a resource. The fact that mental health is being addressed, and that the African diaspora is being included in this conversation is extremely phenomenal to me. You know, I give thanks to our First Lady, Shalane McCray, for even making mental health a platform in this city as it's never been done before, you know, to Reverend Harding and to Dr. Swain for putting this together. This is a phenomenal effort and much needed. But the main message beyond that resonates with me is the issue of taking care of ourselves first as healers, as religious leaders. You know, that old maxim of the airplane where you have to put on your mask before you put on someone else's mask. And with COVID-19, that's like really literal. You know, we have to wear our masks, but that seems to be the hardest thing for us to do. We always want to give. We always want to rush out and, you know, be there for the people that come to us for guidance and for help. And to have that message resonate that we have to take care of us first is a message that we all have to internalize and practice. So those were the things that resonated most to me.
Thank you, Ama. And Marie, what about you? What in this toolkit resonated for you in terms of how you could access it and use it and utilize it to work with your communities?
I will echo my predecessor by saying that it is amazing that the tool exists. It's an overdue tool where I'm quite happy that it exists, although I will make the argument that we need to have it in the languages, in the community languages of various ethnic communities in the city, so that the information can be could be really a tool for them. Because if it's in English, it limits it. It's a barrier still. But I think I will again say that I think the idea of what Oliwara mentioned in terms of putting on your mask before you help somebody else is extremely important. I think self-care is not something that we hear often in our communities. You know, I'm going to take care of the children. I'm going to take care of grandma. I'm going to take care of everybody else in the community. And we're the last usually to think about taking care of ourselves. So I think that message is extremely important, that you're only as a good caretaker as good if you are in good health. You know, you can take care of others if you are in good health. And I think for me, in particular, for my community, what's this toolkit is going to bring as a major asset, and a major thing is the fact that it provides language for us to speak about things that are taboo. We don't speak a lot about suicide. We don't speak about mental illness. And there is this pushback. We never see the person as mentally ill. We're like, oh, he's just acting out. Really, in my community, deal with mental illness in those ways. And I think we have some language here in this tool to help us do the work, to talk about mental illnesses, suicide, it's taboo, you don't talk about it. But I really appreciate the way the tool has framed these things and provided us with language to talk about it at home, in the communities, and with others. Moreover, I think our community, in the Haitian community in particular, has been struggling with attending last rites, the rituals that we do to someone at rest. We don't do, funerals are not happening. I think I like the idea of creating a weekly and monthly space in the community where we can gather and honor those departed, the deceased, without having to feel guilty that we are not keeping the rituals that we're used to, going to the cemetery, grieving in groups, so on and so forth, while we await better times. And I'm hopeful that there will be times when we can return to some of those practices. So those are some of the areas that I think I'm really, really pleased to see that is part of this document, of this box of tools. And I guess lastly, I appreciate the list of resources made available that we can go to and find things to bring back to our communities. And lastly, I will again underscore that we needed to have it in Haitian Creole and other languages so that providers can have the tools, the real tools, can make good use of the tool to service the community.
Okay.
Thank you, Marie. So for both of you, either one of you can dive into this question. Given the times that we are living in, what have you done that has been successful to address the mental health issues in your community at this time? Are there any tools, techniques, strategies that you can share with those of us gathered here this morning that you have found successful? Like just a couple.
If you don't mind, Marie, I'll jump in. It's been an amazing response. We've all had to figure out how to navigate this. But what immediately happened was that I believe, because of course I'm not in everybody's home, but I believe that everyone went to our ancestors and went to our Orishas and started praying. Everybody, I'm sure. We reached out to Asohano to make sure to cover us away from this illness, away from this sickness. And Oshun and Obatala were identified as the Orishas that ruled this year. And so we all went to these orishas and collectively were like, you know, please help us, help the world, help the community, protect us from all that's going on. We were forced to look deeper into the reading of the year that we get annually. And, you know, most of us, we look at it and we go, okay, that's good. And we, you know, we take the advice and we do the FOs. But when these things, when COVID hit, it was like, oh, wait a minute. We need to look deeper into what we were instructed to do. And everybody did that. We looked even deeper. So that gave us even a deeper sense of understanding our own mysteries, even of understanding our own empowerment, the power that our orishas and our ancestors and God has for us. So, you know, we were able to do that. But then we had some really, really specific things that came about that were exact responses to the COVID virus. For instance, we're all now Zoom experts, right? So everybody's become a techie, which is really great. And I want to read this because I didn't want to leave anything out, but to deal with this stress, anxiety, and trauma, and to maintain our mental and spiritual health, several orishas developed, like Gloria Rodriguez from De Amas Institute developed thrice weekly meditations for women to get our empowerment, to tap into ourselves. We had one of our members was diagnosed with COVID, and that resulted in weekly prayer meetings called the Adura Circle, which was formed by Aisha Sories, Ernestine, and Michelle Hunton, and a series of weekly classes and development of respiratory ritual activism from Kiwe Wellness, founded by my son, Oludare Bernard. And we also produced virtual community as well as private Orisha and ancestral musical offerings because we can't get together anymore right now. We have leadership messages and videos from various chapters of Aloshas United and a vision series produced by the Omo Obatala Egbe. Like, everyone is doing everything that they can to address this pandemic, to address this new reality that we're in. And in some ways, it's actually even more powerful because we are committed to not being alone. We don't want our members to feel isolated or feel like they're no longer in community. So all of these events that have been created online are actually helping us to make sure that we do support each other, that we don't feel isolated. You know, our religion is totally about community and gathering and being together. So not having that, we used our ashe and we figured out how to replicate it as best we could. Unfortunately, like Marie mentioned earlier, there's some ways that we simply cannot replicate online, such as our funerary rites. And that did become a struggle, has become a struggle. But even with that, we still figure out a way to gather together, even if it's to Zoom a funerary rite or to have the ancestors call online. The toolkit is where we can work even more profoundly so that the areas that we can't figure out simply as Olorishas, we can go to the toolkit for that next level of help, or that different level of help, I should say, because it's important that we still maintain our mental and spiritual health. And I'm really, really grateful that the toolkit even has several pages of what to do in terms of grieving, of what to do in terms of the fact that we cannot get together. So we're going to use what we normally use and transform it in this new reality. And we're also going to take the toolkit and use the information from the toolkit to help us even progress even further and work together even better.
Ashe, thank you, Ia. Thank you for sharing all of that. And I see some messages in the chat. I will read some of these out loud as well. Marie, what do you have to add
I think one of the things that we did well in terms of some of the groups in the Haitian community is we pushed back on the idea of socially distancing. And we said, you can remain socially connected, but you need to maintain physical distance in order to stop the spread of the virus. So we were on the radio and whatever documents we put out in Haitian Creole and or our gatherings online, community gatherings online, we said we are, while we're online or on the telephone, we are socially connected. We are distantly apart. We cannot come together as we used to do so that we can stop the virus, but we push back because we are social animals. Not just us, there are other animals who live in group, even birds, flock. So we push back on that idea of social because we are here now being social. We are communicating with one another. We are meeting, we're exchanging ideas. We're doing what we would have been able to do face to face had the times were different. We are physically apart, but we are socially connected. So that was one of the things that the community, I know we systematically, because we could not understand, hey, social, I need the socialization. So that was one thing. We also, in the community, reminded members of good old remedies. And that really brought about some foods. The calming teas that grandma used to make in the morning. You know, the soursop tea, the chamomile tea, the lemon tea. We reminded them of these things that we used to do to keep us healthy mentally and physically. I think that was also quite successful in terms of communicating with one another and broadly in the community on that. And I think lastly, not being afraid to share our stories, being vulnerable. People, professionals, when we gathered online, we said, well, this week wasn't a good week. I was having a tough time. I was dealing with my students and this is how I felt. Or giving people space to be vulnerable, to cry and to share their stories, I think allowed us to feel connected and to feel that we're in this together and we're gonna get through this together, among other things. I'll cede the space for somebody else to add on to the conversation.
Thank you, Marie. Thank you both. That's beautiful. I want to read one of the things that Queen Mother Dewoti posted in the chat, just so you all can be aware of other things going on. She wrote that in the ATR communities globally, they have been working across the Atlantic Ocean to do ritual work and host discussions related to both COVID and 600 years of trauma that impact African descendants globally. We are also hosting an Oro Egun in November to help those spirits who have made an especially painful transition during the COVID era. So just wanted to actually speak that into the space. And there's also other comments. I see Ia Funlayo, and also Queen Mother had said that. She's mentioning Dr. Wade Nobles and Dr. Joy DeGray in terms of their work on post-traumatic trauma. One thing that I wanted to add before I turn it over to open up the space and allow you all to ask questions, because we do want to have a few minutes for that, is that the seminary that I work as co-director, that we did compile some resources specifically for communities of color, or Ministers of Color Alumni Association, and it's specifically for the communities of color in New York City that was impacted by COVID. So I am going to post that now into the chat, the link, and we are still adding to this. Hopefully you can see that link in the chat. And I hope that it's helpful to everyone, especially if whether you live in New York or not, you may know someone here if you're not living here anymore. And we will continue to update that list as we gather on a monthly basis and compile more resources. And to finally just echo what both Marie and Iyaama were sharing in terms of that self-care. Vicarious trauma is a real thing, and it is going to impact any of us who are working in our spiritual communities. If there's any resource that I can share with anyone gathered on the call, please let us know, let Henry know. I'm happy to share free information on how we can better care for ourselves. First being awareness, balance, and connection, being aware of how trauma is affecting you, your body, balance, looking at how you distribute your time and your energy, where you need to give more, where you need to pull back, and the C for connection, connecting with spirit, connecting with the things that transform pain, and connecting with those things that give us new life and a new lease on how we look at things. So I'm happy to share that as well.
The natural environment, being able to go to the river, being able to do certain, do certain kinds of cleansings is part of our tradition for establishing mental wellness.
Sheridan,
I'm sorry, I'm going to.
I'm sorry, everything that you're saying is wonderful.
Go ahead.
We are on a time limit.
Sorry.
And it is time for us to wrap up. And Trini, I see that your hand is raised. Can you make your share in 30 seconds?
Thank you guys, I'm sorry.
It's okay, it's okay. We don't have these spaces to come together and gather a lot. And we are working with time constraints, so I apologize for that. But Trini, if you can make your comment briefly so that we can turn it back over to Peter and wrap up, we'd appreciate it. You have the floor.
Okay, great. Can you all hear me?
Yes.
Hi, good morning, everyone. I just want to thank Lori Wa'ama for inviting me. And it was great to see so many familiar faces. But I just wanted to say, as a medical practitioner, I think the work that we do in our spiritual communities are excellent. But also, I love how there's a resource, especially in New York City, in place that we can work in conjunction with medical professionals, like that mobile response team that the gentleman spoke about, in addition to spiritual work, because our rituals, our spiritual stuff is very important, but sometimes medical needs to be included in mental health as well. It's just like if somebody fell down the steps and broke their leg, we wouldn't just do ritual on them. We would say, go get casted, get your leg fixed, and then we'll do ritual to help you to continue through the trauma of breaking your leg. And so I would love to see resources like that extended, where there can be a balance between spirit and when a person needs actual medical intervention. That's it. Thank you.
And thank you, Trini, for that. It's very important. Thank you all for your time and attention, for being here, your energy. I know there's a lot more to say and discuss, and hopefully we'll have the opportunity to do that at another time. And now I would like to turn it back over to Peter for our closing.
Thank you so much. This has been a very interesting conversation. And I would also like to point out this has been our largest webinar, so I really appreciate the fact that the African Diaspora showed up. That is very exciting for us. So I did want to remind everybody that you will be getting an evaluation, and I hope that you'll share from the heart when you get that piece of paper, because it will allow us to give feedback to Thrive NYC. And I want to call out Alex, who's with us on the webinar from the Thrive office, to make sure that we are working with Thrive and the Interfaith Center to develop the best possible resources for the communities and voices that you represent here in New York City. I'd also like to say that the unique ministry of disaster spiritual care is not something that has well representation from the African diaspora traditions. And I urge you all who are caregivers in your community to consider that as an opportunity to volunteer here in the city. Obviously, we're extremely diverse as a city, and we have people from across the globe here that would benefit enormously from a crisis spiritual caregiver from the traditions that you represent. You can feel free to reach out to me or Henry if that is something of interest to you, and we can find a way. It's hard right now to do training, obviously, but to find a way that we could bring some of you together and get you certified so that you could participate in that public ministry in times of crisis. We are very appreciative of all of the time and talents of both Stephen and Dr. Swain, and our wonderful panelists. It was really incredible to hear how gifted you all are and your insights into this work. And thank you to all of you who joined us today. I hope that in the coming months we'll be able to work with Thrive to make this toolkit available in the languages of your communities. And please let us know what your priorities might be in that area. But also encourage all of you to make the toolkit accessible to those who don't read well. Many in our communities are not able to read these sort of technical manuals sometimes. And so having that information shared verbally in that tradition of passing on things verbally is important in all communities where these resources are not necessarily accessible when they're printed out online. Also, they're expensive to print sometimes, and people don't necessarily have printers at home and things like that. So making it accessible that way is important as well. For any of you that haven't taken the curriculum, Mental Health First Aid is offered by Thrive NYC and the First Lady's sponsorship. I encourage you to take that if you haven't taken it. It's a great introduction. There's also many other trainings available to all of you as caregivers, like psychological first aid, which is an intervention used in times of crisis. So please consider those as well. So thank you for joining us today. Be well, and I hope that we will have the opportunity to gather again and see each other at future events, hopefully in person. The sooner the better. But in the meantime, I definitely agree with Marie's insight that we should keep our masks on for now and try to stay safe from passing the virus and protecting our elders and those at risk in our communities. God bless and take care.